Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, welcome to today's podcast. What I want to talk about today is depositions. Depositions are something that oftentimes the doctors, don't want to do, have a hard time with. No one really likes depositions. I'm going to tell you right now that depositions are incredibly fun. And depositions can be incredibly helpful to your practice expansion. When you're good at depositions, your practice will expand. When you're good at depositions, you're also going to be good at testifying in court. And when you're good at that, that's exactly what attorneys are looking for. So let's talk a little bit about why are they hard, or why do doctors struggle with them so much. I'm going to tell you right now, the biggest reason why doctors struggle with them is because they do not know how to and have not accurately determined just how badly damaged the patient's spine is. So the majority of doctors in the market today, when a person comes into their office with a spinal injury, do not know how damaged the patient's spine is, no matter what testing they're doing. Now, that is if they're not specially trained. We have a Smart Injury Doctors program where our doctors are specially trained. When you injure a spine, there's only 3 injuries you can have. It's really simple. It makes depositions incredibly simple. You have only 2 parts to a spine. You have bone and you have connective tissue. In order to damage any body part, you have to derange it. You have to injure it. It's impossible to injure a human body or a human body part without injuring it, and it's impossible not to derange that part if you've injured it. So with the spine, all you got to know, you just have to know what are the 3 injury types. In other words, if I got bone and connective tissue, if I got bone damage, obviously that's a fracture. Okay, there's different kinds of fractures. There's compression fractures to the body. There's transverse fractures. There's spinous process fractures. So there's different types of fractures to the spine itself, right? So if you specialize in spinal fractures, you should know everything there is to know about spinal fractures. But in the majority of offices, that's not what you're dealing with. What you're dealing with is connective tissue injuries. Okay, so connective tissue to the spine. There's 220 specialized ligaments that hold the spine together. Now, most doctors have no clue about those ligaments. They have no clue they know that one of the ligaments is called a disc. There's 23 discs, right? So the amount of misunderstanding in this area is rampant in the injury space, right? That's why there's so many chronic pain patients walking around, because there's so many doctors that do not understand ligament injury. Ligament injuries just cause 2 things that you see on imaging. One, if you got a disc, there's 23 discs, you can have disc herniation. The only way to pick that up is on MRI. But what about the 9 ligaments around the disc? What about the other 197 ligaments called non-disc ligaments? These are the main support ligaments of the spine. These are the main ligaments that cause stability, or when damaged, cause instability of the spine. These are the main ligaments that hold the disc in position, right? So these are some of the most important ligaments there are. Remember, there is no disc in the cranial-cervical junction. So people that have headaches, people that have facial pain, that have cognitive dysfunction, that have balance problems, that have vertigo, that have visual disturbances as a result of ligament damage in the cranial-cervical junction, you're not dealing with a disc at all. So in the market today, there are doctors that only know a little bit about the ligaments, and they only know about the discs. They don't know about the non-disc spinal ligament injuries, right? When you don't have the spinal injury, so it's real easy. Patient comes in, good, what do? I actually have to assess their injuries. I know, did they fracture the spine? No. Is there connective tissue damage? Called a sprain? Yes. I believe there is. Good. So I've got to do excessive motion testing. That's the very first thing I do. The more excessive motion there is at a motion unit, the more damaged the ligaments are. That's it, period. That's the easiest thing to do. Now, once I actually know, let's say I know that C4 on C5 is badly damaged. It's got severe excessive motion. Good. I know that C5 nerve is what goes through there. I know that. So I can do a muscle test. I can do a C5 muscle test. I can do a deltoid muscle test. I can do a pinwheel test to see if I've got abnormal sensitivity there, right? Or I can just look at it from a pain point of view, but I know exactly how damaged this is. And I also can go in between 4 and 5. If I palpate in there, I'm going to feel inflammation. So it's really, really simple. Now I have this. This is what I have. I have severe damage to the non-disc ligaments. It's severe. It causes spinal instability. It's causing an actual neurological condition. It takes me 5 months to treat it, to resolve it. Now I'm in deposition. How hard is deposition? I'm sitting there going, okay, this is what I have. This is what the consensus says that this means. It means I've got a major spinal instability here. If let's say I've got a level of excessive motion that meets the criteria for alteration motion segment integrity, which is a finding for impairment evaluation. Good. That same finding is the same finding that you'll find in spinal surgery guidelines, right? So if there's that much excessive motion, it says that the person is, pre-authorized for spinal fusion surgery. This is what I have. This is a consensus I have. This is Medscape will tell me exactly what are the symptoms that I can expect. And it's all laid out right there. This is the injury. It's consistent with the mechanism. This is what was delivered. This is the extent that the patient had it. And now I'm explaining it, but I'm explaining it with, okay, my ICA best practice guidelines say that if I'm going to take an x-ray, I'm supposed to do a subluxation analysis. That means misalignment of the vertebra, C4 and C5. See how it misaligns here? Yeah, it causes nerve interference. See how it causes nerve interference to the muscle on the deltoid test? Yes. Good. I'm to determine the amount and the severity of any spinal soft tissue injury. See how I did this excessive motion test? Yeah, that's exactly what the x-ray guidelines say. The more excessive motion, the more severely damaged the ligaments are. So if I have severe excessive motion, I have a severe sprain. If I have moderate excessive motion, I have a moderate sprain. If I have no excessive motion, I have a mild sprain at best. Good. Do you see how the treatment guidelines over here that I use actually takes this ligament injury and places it right into the treatment guidelines for frequency and duration of treatment? Yeah, well, that's what I did. Good. See right here where at Medscape, it says this is what this condition causes? Yeah. Do you have any questions? No. So why am I here in deposition? This is all in my notes. Why am I here? Well, doctor, is this condition permanent? Yes, it is permanent. How do you determine it's permanent? It's permanent through the AMA guidelines. It's also permanent in the fact that anybody who researches can show and look and say that ligament injuries are permanent. Doesn't matter what joint you receive them at. If you have a bad ankle sprain and you badly damage the ligaments, you are potentially going to suffer with that for the rest of your life, right? So this is not hard. Does it cause degenerative conditions? Yes, it accelerates the degenerative condition in the spine. It's the main cause of future degeneration to this spine. That's why the patient is either going to need some form of ongoing supportive maintenance care to help keep that area as healthy as it possibly can to minimize the future exposure to osteoarthritis. Doctors, is just that simple. Now, what you get into and what the majority of doctors get into is complicated explanations that are they're boring. They're dry. Nobody understands it. The plaintiff attorney doesn't understand it. They're just trying to keep their eyes open. The defense attorney doesn't understand it, and they love the fact that they don't understand it because they know damn well if they don't understand it, that the jury's not going to understand it either, right? So they like that. It's confusing. And they like to confuse the doctor because they know the doctor's already confused. They know that the doctor is very confused. They look at the notes and they go, if I don't understand this, nobody can understand this. I'll bet you damn straight the doctor doesn't understand this either. Now, this applies to you whether you're a chiropractor, whether you're a doctor of physical therapy, whether you're an orthopedist, whether you're a neurologist, whether you're a physiatrist, you're the top doctor in the country. If you don't understand the simplicity of the injuries and you don't understand the simplicity of the workups and you haven't done it, then depositions are going to be a little bit rough for you. If you have done what I just said, depositions are, the only thing you're going to do is go, they're kind of they get into my schedule and I got to schedule them and they're kind of a scheduling problem. But other than that, they're not a problem. I mean, when I'm sitting in deposition, it's super, super easy and it's super simple. And what makes you highly effective in deposition or in trial is when you're super simple. That's it. That's the thing that makes this very easy. Now, we teach doctors, there are so few doctors that know about the non-disc spinal ligament injuries, and we have a specialized program called the Smart Injury Doctors Program. That's a program where we train doctors, it doesn't matter, medical doctors, chiropractors, doctors of physical therapy, anybody that treats the spine. We train them on these non-disc ligament injuries so that you can become a specialist in spinal injuries. Without understanding the non-disc spinal ligament injury specialists, the non-disc spinal ligament injuries, as far as I'm concerned, you are not a specialist in the spinal ligament market, and you probably or possibly should not be treating these injuries, because these are the things that cause instability in the spine, and the patients ought to have a good diagnosis, an accurate diagnosis, and they ought to know what they have and what their future can be. Doctors, when I do a podcast, it's short, sweet, excuse me, right to the point. And so that's all I do on these topics. If you have any comments, put it down below. I hope this has helped you in some way, and I look forward to seeing you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals that want to deliver better injury care to their markets. If you like what you heard today, please leave us a review and don't forget to join us on our next program.